All right, hey there, Dr. Ryan Hetland here, River Heights Health and Injury Clinic. Today I want to answer a question that a patient brought, which is, what is the best pillow for me? How do I sleep? And how do I know that it's good? So this particular patient had trouble. She slept on her stomach constantly, and sleeping on your stomach is not good for your neck, and I'll teach you why. So here's a pillow. I'm going to use an example. This is Nicole.
Hi.
So here's the spine. Your neck, as you're looking at this thing, like Nicole, look this way for me. Her neck curve right here should be curved like this model here. So what you're noticing is the spine should curve out here in the middle of her back. She should have a curve here. And her skull, if you look at it, here's her neck, here's her skull. So you're getting this difference, and that's what you need to make up for in a pillow. Now turn and face the camera. When you're sleeping on your side, there's this space difference between where her shoulder is and her head. So we'll kind of use this as an example. So when we use any pillow, this is supposed to be a great pillow. And I say supposed to be because no one pillow is perfect for everyone. And just like no shoe fits everyone perfectly, this shoe is not going to fit her great. It's going to be uncomfortable, too big. I'm not going to be able to fit into her shoe. No pillow is perfect for everyone. So no matter what pillow company says they have the best pillow ever, not pointing out any names of them, just using this one as an example, it's a good pillow for if it fits you. So it even shows on here an example of what I'm talking about with the neck curve. Someone where if a pillow doesn't fit right, which I'll show on Nicole, their neck's going to be flat and pushed forward. If it fits right, you'll get a nice curve that's supported in this thing. So let's see if it fits Nicole right, even just on her back. So go ahead and lay there, Nicole. So here's where she should be, right here under her neck. This is where this support is. This is supposed to allow her skull to go in, like on the back part of this model. But that is not going in. So you can see how her head is pushed up. So instead of having a nice supported curve, her head from the skull is getting pushed up. So her neck is flattened out because of this pillow. This pillow does not work well for her at all. Now maybe if she rolls on her side, so let's look at her on her side. Roll on your side for me. So I want to point out one thing about laying on your side. I never recommend laying on your side like this. Okay? See how she's on the tip of her shoulder? This is really uncomfortable and pushes all this weight into her neck and into this lower part, upper part of her back. So if I was going to correct this, we would want to keep the spine neutral. So see how your hips are here and your thoracic cage is twisted? Mm-hmm. See how she's twisted? Her pelvis is up and her shoulders are back, so she's torquing her spine. What we want to do is get her pelvis here back, so somehow her spine's more neutral. Like so her nose is neutral with her pelvis. Mm. So when you're trying to find a comfortable position on your side, you want to be on the back part of your shoulder, and you want to have your hips in alignment with your shoulders so you're not torqued. Mm. So laying on your side, that's important. So this pillow, let's look, is not bad. Her head's still pushed up a little bit. Can you see that, Lena? Yeah? So her head's up, meaning the pillow's too big for her. When she's laying like this, when the pillow's too big, her head's getting pushed up. So it's creating a kink here. And if the pillow was too small, her head would sink down and it would create a different kink. The thing you want is your spine to be neutral and supported just enough. So the challenge is if you lay on your back versus laying on your side, you need different thicknesses of the pillow. So some pillows come with a big hole in the middle. Those work good, and it's built up on the sides for when you're on your side versus laying on your back. Now, when you're on your stomach, it makes zero sense altogether. Yeah. Do you lay on your stomach ever?
Rarely.
Okay, go ahead and try and lay on your stomach on this pillow. So that actually is probably similar to how people might fall asleep. They have their arm maybe underneath the pillow, bunching it up. Her head's tipped up, right? Some people will do that, yeah, and their head's tipped up. Their spine is contorted, twisting that out, and what's going on with her neck? She's twisting her neck severely to the right. That's causing a ton of twist on her spine. And I'll have patients come in and their neck's always out, needing an adjustment, and they're stomach sleepers, and it'll always go out because they're every night sleeping on it for hours.
Yeah.
And so stomach sleeping's bad in that case. Now this is just about your pillow. Same thing with your mattress. If your mattress is not supportive enough, your spine's just going to sink like this. And if it's too firm, your shoulder won't sink in enough and things will just happen and it's not going to be comfortable. So this isn't to plug any particular mattress or pillow. It's just give you an idea of what to look for when you're trying to find a good night's sleep. Sleeping on your stomach, I've never found any good position that's good on your spine, that's good on, I mean, unless you had a hole in your bed and you could sleep with your head face down, but even then, like in a massage table, you're not going to be able to lay there for 8 hours, 7 hours comfortably. So you have to learn how to sleep on your back and your side, and you have to find pillows that will fit kind of your category, and you have to try them out and see which one's more comfortable. It's trial and error for everybody. So I hope this video helps you, and anything you thought of while I was doing this video that...
No, that seemed to cover it all.
Okay. Have a great day. I hope you found this video helpful. Share it, like it, and I'll have more to come.